thank you, Dr. Fancher, for meeting with us. We would love to hear more about your story and what you do for your line of work.
All right. So I'm a professor of pharmacy practice, and my specialty is oncology, so cancer drugs. I'm at Duquesne University, for those guys that are outside of this institution. So just a little bit of background. I grew up in Latrobe, Pennsylvania, home of Mr. Rogers and Rolling Rock Beer and all that fun stuff. I actually went to Duquesne, and I was their last bachelor's class in 1998, and got my Pharm.D at Duquesne also. I did a PGY1 residency at Thomas Jefferson University Hospital in Philadelphia, and then I did a PGY2 in Tampa, Florida at the Moffitt Cancer Center, where I practiced oncology for 10 years after I graduated from that residency. And then moved back to Pittsburgh, and now I'm working at Duquesne teaching oncology, and my practice site is UPMC Passavant.
Okay, so what is your favorite aspect about working with this patient population?
Lots of things, I guess, if I could narrow it down. I love working with cancer patients because I feel like they're really grateful, right? I mean, I know this is a terrible time in their life, but in general, I feel like those patients are so appreciative of like my input and my presence. Like, I don't want to disparage any of my colleagues in other areas, right? But nobody ever hugged me for adjusting their warfarin, right? Like, nobody ever high-fived me for changing their statin to something else, right? Those things are so important, and they are, but patients don't see it as that important, right? Versus, like, I've been to my patients' weddings, right? I've been to a lot of funerals, but I've been to their weddings. I get Christmas cards from my patients. Like, I feel like I really have a meaningful relationship with them, and they appreciate it. So that's my best part, I think, about working with the patients. Right? For me, I have always been one of those people that, like, this is my area, right? Like, I own this little niche of the world, so to practice in an area where not a lot of other people choose to go, and it's up to me to be the expert, like, I really work well in that little setting. So for me personally, I really like the challenge of, like, I gotta be on my A game every day, and if I don't know, it's up to me to find out. I can't, like, ask my colleagues. So I like the challenge, the mental challenge, personally and professionally, but working with my patients, I think, is the best of all of it, so.
All right.
So I guess to go more into that, what would be like a really unique experience that I guess made it so it began it all, in a sense? Like, what started the ball rolling, essentially?
Do you mean, how did I get into oncology?
Yeah,
So, I mean, I guess I like to joke that I, like, backed my way into oncology. Like, in my last year of school, I had no idea what I wanted to do. None. But I knew what I didn't want to do, right? So I knew that I'm not a good cardiology student, right? I have no desire to ever do administration. So I was kind of like moving things off the list, but I didn't know what I wanted to do. And then we got to oncology class, and I had a really dynamic professor, and I was like, oh, maybe I should take that rotation. So I took his rotation, and then coincidentally, I took a rotation with his mentor. So I got kind of like the mentor and the grand mentor, if you will, and they both like just sealed the deal for me in terms of that area of practice. And one of those rotations, I was at WVU, and there was a really, really young kid that was getting a bone marrow transplant, and my preceptor assigned me to go play what would have been Xbox, right? I mean, you guys have Xbox now, but it was something different. But he assigned me to go play with that kid 1 hour a day, right? Because he was alone, his parents weren't around. So, like, just connecting with a patient that was almost my age at that time, and then just, you know, those two gentlemen who have been so influential in my career. I think I was put in the right place at the right time.
Gotcha.
But I didn't, like, go into pharmacy school being like, this is it, this is what I know I want to do. I think I just kind of got there kind of late in my career, or late in my education. So.
Okay, so we're also, another reason why we're interviewing you today is because you have a unique experience with cancer itself. So can you delve into that a little bit?
Sure. So in addition to practicing in oncology, I also have cancer. So in 2014, I got diagnosed with breast cancer. I can tell you a little bit about that, completely off guard. Right? I had absolutely no idea that was coming. The backstory was, I will teach you guys in class that when you turn 40, you're supposed to get a mammogram, right? That is the gold standard. So I was about 39 and a half, and I went for my routine doctor's visit, and she looked at the chart, and she was like, oh, next time I see you, you'll be 40. So here's a prescription for a mammogram, right? And I took that and I shoved it in my purse, right? And I carried it around for a couple months. right? Because everything was fine, right? Like I made all these excuses in my head, like I'm not 40 yet, I'm so busy, nobody in my family has ever had cancer. I feel, I would feel something, I would know if I was sick, right? So I just didn't see it as a priority, right? So I just walked around with it for a while. And also, I just had in my head, like, well, that's not gonna happen to me, right? Like, that's just way too ironic, and I'm a good person, and all those excuses, right? So, so then we got to oncology class, and I stood up in class like I do all the time, and I said, the standard of care is a mammogram when you turn 40, and it just felt so fake coming out of my mouth, like I wouldn't do what I'm preaching to do. So I got it done, right? And there it was, right? Like, I never saw that coming. My doctor told me later she never felt anything. Like, I'm so lucky. What if I walked around for another year or thrown that out? Like thrown that prescription out.
Mm-hmm.
So, yeah. So that certainly pulled the rug out from under me, right? Like, I actually got diagnosed in class, like during class. They called to leave the message on the phone while I was teaching.
Oh, wow.
Right, I heard it afterwards. Fortunately, I wasn't teaching about breast cancer that day, right? But I think that definitely gives me a different sense of authenticity than some other professors. So, yeah.
So having found out about this and also being an oncology professor, like, how did your knowledge of the disease state, treatments, and other influences like affect your feelings towards it?
Well, I like I just said, like, I think at first, like, I just thought this had to be a mistake. Right, like this just cannot be true. And I'm sure all patients think that, but I think me personally, I was like, what? I've spent my whole life taking care of people that have cancer. Like, this just cannot be true, right? And then I think objectively, I know all the survival statistics, I know all the drugs, I know all the tests to be done, like I know all those things, but I was still scared to death, right? Like, even though I know it, like that was, like, I was detached from it before, right? So I think that even though I knew way more than the average person when I got that phone call, it still freaked me out a lot. So, yeah.
Okay. Would you mind telling us a little bit about your individual treatment regimen?
Yeah, sure. So we talked in class about there's like staging, right? Like how big stuff is. So I actually had a pretty decent sized tumor, but it had not spread. So it was not in my lymph nodes and not in any other organs, right? So I was able to have surgery, which was a very good thing. But also, I haven't taught you this, but I will on Monday. At that time, there was a test you could run on a patient's individual tumor. So breast cancer is like one of the only diseases where you can do this, where they take a sample of that tumor and mail it to a lab, and they look at 21 different genes. So not just like the proteins of that tumor, but like the genes, right? So that test is called Oncotype. And the Oncotype spits out if you would benefit from chemo or not, right? So there was like a 2 in 3 chance that I was going to need some chemo. And because I'm very young, relatively, for breast cancer, I'm very young, right? So there was a pretty decent chance that I was going to have to get some chemo, right? But I was insistent that we run that test, and my oncologist didn't want to do it, right? But I ran it, and the results actually came up low. So I did not actually need chemo, which was a big surprise, right? A big surprise and a huge relief, right? So I had some pretty aggressive surgery. I did not need chemo, and it also wasn't in my lymph nodes, so I did not need radiation. So I got a pass on like quite a bit of the treatment. So now I'm taking the hormone therapy, which is supposed to be for 10 years, but will probably be for the rest of my life. But in the big picture, I don't mind. Right? It could have been a lot worse.
Yeah, absolutely.
Yeah.
So given your background, do you feel that like the other clinical experts or other people involved, did they allow you to have influence over your treatment? I mean, obviously you said you did the testing,
right.
But like other than that, was there anything else?
Well, I like have a really unique experience in that I chose to get treatment where I work, right? Like I don't have to get treated at UPMC. I have insurance that allows me to go anywhere in Pittsburgh. But I chose to go to the facility that I work with, right? And for a lot of reasons, but one of them was I already knew all those doctors, like more intimately probably than most people know their doctor. And I felt like I could make the choice as to the ones that would give it to me the most bluntly. Like, I just wanted honesty from my doctors. Like, we don't have to be buddies, right? But I just wanted honesty. So I got to choose my oncologist. Like, I actually walked into the office of a lady that I work with, and I was like, listen, I need some help here. So I had that advantage. I will say that I got to choose amongst the 5 doctors that I work with, which one I thought would most align with what I was looking for in treatment. But I also think that, like, the staff treats me with the utmost respect, but also the same way they treat other patients, which it was exactly what I wanted. Like, I don't want to skip in line because I work there, or I don't want them to give me what I want because I work there, right? I want what I need, right? So, and by that I mean I wanted my physician to tell me what she would tell everybody else, or recommend the same things, like not sugarcoat it for me just because we work together.
Yeah.
So, yeah.
So, I don't know how to phrase this.
That's okay.
I don't want to read it like word for word from this, but I guess I'm gonna have to. So, how did your experience as a patient color your viewing of your job, treatments for cancer, and even the patients you see day to day?
Yeah. I have all kinds of thoughts here. So I guess, first of all, like, I need a lot of therapy, gentlemen. I need therapy. No, but I guess I just have all kinds of, like, I don't understand still, right? I still don't understand why this is. Like, for example, I don't understand why at 39 years old with no family history, like, this just struck out of, like, out of nowhere. Like, I still don't understand that. I probably won't, right? But I also don't understand how I have such a good type of cancer that I don't need chemo when I work with people that get chemo all the time. Does that make sense? Like, I have, like, intense guilt that I don't have to get chemo when all these people do, right? So that has been, like, very, very, like, internally, man, I gotta find a way to make my peace with this, right? Like, I am one of you, meaning I am one of you cancer patients, but I don't have to get what you get, has been very, like, oh, I don't know what I think about all this, right? I think I have even a greater sympathy for patients who get chemo than I did before. And I also think those patients are so brave, because when the concept of me getting chemo had me, like, literally in tears, even though I knew all about it and all this, I was like, I don't know if I can do that, right? and I would have, if that's what it came to, I would have, but I'm glad I don't have to test that theory, right? So that, I have a lot of feelings and anger about breast cancer as, like, the poster child, and for cancer, and being strong and being a warrior and never giving up and being brave and all that. Like, those are wonderful things. They are. But I was on the bandwagon too, you know, like, on the breast cancer awareness and all this. And after you've had it, like, it's more, I think breast cancer patients have a lot of pressure to be strong and fight this and be a warrior and wear pink and all this. And then there's not a lot of permission for breast cancer patients to be scared, right? Like, to be not so sure, and to, like, have a moment of, okay, maybe I can't do this, right? So, I mean, I think I'm hyper aware of that now, right? Where before I was just like, hey, it's October, get mammograms, right? As you should. Now I'm kind of like, oh my God, I was projecting that those patients should not be afraid or scared. And of course it's okay, but just that whole, like, warrior mentality of, like, you're a shero. Oh, I hate that term. You know, like that. Like, I think I'm more sympathetic to that the patients are probably pretty scared. So, yeah.
So based on your experience, what would you, like, I guess, suggest or advise to other practicing pharmacists, like, in your field, based on the experience you've had?
Well, I guess, again, all kinds of things. I mean, for people in my field, like I've always said, for students that are interested in oncology and stuff, this is a sad area to practice, right? A large amount of patients are not going to have the outcome that we want. So you have to have some sort of outlet for your thoughts other than reading or studying or something. Like, so I always tell the students, like, you should have some sort of hobby, something you do besides take care of patients. Like, it doesn't matter what it is. Like, join your church, or go run the marathon, or, you know, watch Netflix, or whatever it is that you do. I would say that to anybody, but I think that now even more, that, like, I work with patients that have the same disease that I do. Like, there's got to be a way to stop thinking about this nonstop like that. patient-wise, I guess I'm still in awe of how strong and brave and graceful a lot of my patients are, especially when it's not going the way that we want it to go or they want it to go. But I think I'm much more sympathetic to, like I said, that you don't have to be a warrior all the time. Like, it's okay to have a moment of, man, this sucks, right? Or I don't know what I'm going to do, or those kinds of things. And then I guess my last thought would be for patients, there's like this perception in America that when you have cancer, you have to like overhaul your life. You have to like do something so much different when you beat this, you know, like you have to quit your job and like, you know, go to a foreign country and save all the animals, or, you know, like some sort of like change your life in some way. And that just wasn't my experience, right? My experience was more like, I just want to live the life I have, but live it better, right? Like, I just want more time with my kids. I just want to take a vacation with my husband that we talked about. Like, I didn't feel like I had to do a bucket list. I just wanted to like double down on the life I had, you know? So I think that was a big mental shift for me too. Like, you don't have to overhaul your whole life. If your choice is to live this better or deeper or stronger, then that's cool too. There doesn't have to be like, you quit your job and go to culinary school, you know, or something like that. So that I think was a big eye opener for me. So, and I would say that to any cancer patient: you do this however you want to do this. This is your decision, not what America thinks you should do, right? Or the television show suggests that you should. So, yeah.
All right.
Yeah. All right.
Well,
Thanks for having me, guys.
thank you so
Thank
much for
you.
answering our questions.